Social determinants of health was identified as a top gap across our community. So we think about social determinants of health, we think about housing, transportation, educational attainment, access to food, and then access to economic resources just to have the overall whole health and well-being. We are located in a federally designated food desert area. This really means two things. One, our population has an economic disadvantage to accessing healthy foods. Secondly, the prevalence of healthy foods within these geographic locations can be limited.
Food insecurity is extremely important. We have studies out there actually looking at if you give people just $15 to $20 worth of nutritional food of fruits and vegetables every month, that you can decrease their hospitalization rate tremendously. And I think that's so important as we're looking at how do we keep our community healthy and really just do a service to our community. We've been asking everyone with children in the clinic, do they have enough food? Do they ever run out of food? And those questions just become really surprising for some of us providers to see who is out there and actually needs food that we had no idea.
Our food access initiatives encompass 3 different strategies. First, our food pharmacy, which is an on-site pharmacy that we dispense healthy foods. Second, Fresh Delivered is a place-based intervention where our Fresh Delivered van delivers foods to seniors in low-income apartment buildings. And third, our farmers market, which is an on-site access point for healthy, nutritious foods for our entire community.
My farm, it's just under 12 acres, and most of it's in some type of production. I grow over 60 different varieties of produce, and sometimes more than that. It's tough to find fresh fruit and vegetables in the area. The biggest industry is agriculture. There's a lot of small grains, corn and beans, but that's mostly for livestock feed, ethanol, other products that aren't directly consumed by us. So I take pride in knowing that I'm providing highly nutritious and really fresh, local, and flavorful food for community members. I think it's important for hospitals and health systems to be involved in food system efforts like this because food is such a basic need of all humans. Food is the basis of our health, and so it should be one of the first things that should be discussed.
So not only is Lakewood committed to helping bridge the gap between healthy food access, but we're really looking at embedding some specific skills and competencies with those that we serve and changing behaviors at home.
When we first moved up here, I started working at the hospital. At the time, my son was having issues. We decided that I would just stay home and homeschool my son. I ended up having to quit my job. So we were short on income, and we heard about the food pharmacy at Lakewood Health, and we've been a part of that for a few years. On top of the food that we receive, we also do some classes. So I've learned a lot about budgeting, grocery budgeting, and household budgeting. It's changed a lot in what we eat, how we prepare it, for sure, how we spend our money on it. When we're preparing the food, we're spending more time together and enjoying it more. It's just been a blessing to us.
80% of someone's health happens outside of the walls of a hospital or a health system. And so it's really important then to look at, okay, how are they supporting that other 80% of that individual? Hospitals can't do it themselves. Public health can't do it themselves. We really need to look at ways that we jointly collaborate so that we can make sure that people are getting the resources they need and access to services.
Hospitals are for sick people. We're trying to keep our population healthy, and if we don't get out there and work on community wellness and partner with all the other organizations, then we're not living up to what we're supposed to be doing. I believe that it's every hospital's role and duty to work outside their 4 hospital walls. We are all in this together. We all have to keep our populations healthy.